Our next burning question comes from Carolina.
I love to curl my hair, and sometimes when I'm in a hurry, I tend to burn myself. I wanted to know if there was a way that I should treat this at home, or when do I need to go see the doctor? Is there any way to avoid getting a scar?
We've all accidentally touched a hot curling iron, or maybe women have touched it too long to their scalp. So let's talk briefly about the different levels of burns. First degree burn, much like a sunburn, it's going to get a little bit red, be painful. Second degree burn, you'll usually see some blistering. That goes all the way through the epidermis into the dermis. You can get some scarring from that. Third degree burn is what we really get worried about in medicine. As you see it there's no blistering because you've gone all the way through the epidermis and dermis into the subcutaneous tissue. That skin will never grow back. You will not only get scars, but if you burn a big enough area, that's where we'll use skin grafts. Probably not likely with the curling iron. But what you want to do regardless, if you have one of these more superficial type of burns, which is what we usually see with the curling iron, is not make the common mistakes. Number one, you don't want to directly apply ice. Ice is too cold right after you burn something. So cool water would be better. No grease, no butter, those old wives' tales. Don't do that because you're risking infection.
That's why in the first aid treatment of a burn, you want to apply, like you said, not icy water, but cooler water.
Cooler water, and it doesn't take long.
Ooh, ouch.
Yes, that's what can happen to your scalp or any part of your body that touches a curling iron. And as you can see here, that actually burned through the skin, much like would happen on human skin.
So let's talk about a little burn first aid. What you want to do with a first, second degree burn, put it in cool water. If it's a larger area where you can't actually submerge it in water, you can use a cool compress like so. After that, apply either an antibiotic ointment or something with aloe. Arnica also is something that you can use. As far as pain, use a non-steroidal anti-inflammatory like ibuprofen. And finally, especially with a blistered burn, you probably want to gently wrap that to keep it clean, to protect it. You want to let those blisters stay intact, let them burst on their own.
And then the other big thing is, even after having a superficial burn, if you notice that 2, 3, 4 days later, the redness is actually expanding, it's warm to the touch, certainly if you see any purulent drainage, that's the sign of a likely infection. So you're going to want to be seen. You potentially have to take some antibiotics. But otherwise, most burns, superficial ones, if you treat them accordingly, they'll heal just fine.
Right, and the question was in terms of scarring, the single biggest thing you need to do is stay out of the sun, is protect it from direct sunlight for weeks to months, because that's the single biggest thing that will cause darkening of that scar. And putting something on there like aloe, vitamin E to help promote good healing, that'll keep that scar at bay.